All right. All right. Welcome, everyone. This is the third episode of Friendpreneur Fire Podcast Unbound. And I am Tiffany Barchman, CEO, founder, and visionary of Friendpreneurship LLC. I am very excited because this community is all about building up entrepreneurs, right? We connect entrepreneurs through targeted networking and live storytelling events so we can succeed in business. Learning from each other is key. And as entrepreneurs, oftentimes we are solopreneurs as we get started. There are others who have already been there, done that. Why not work together, right? So, friendpreneurship is about building a community of trusted friendpreneurs so that we can work together, learn, and continue to grow. Now, as your host of this podcast, I like to find stories, right? I love storytelling and I love hearing about entrepreneurs. Why you do what you do, right? People don't buy what you do, they buy the why. And this is a famous Simon Sinek quote, an author and inspirational speaker. I quote it all the time because I truly believe it. Whenever I have an experience, whether it's with a product or service, if I've been on a trip, if I've eaten food, if I've bought a pair of earrings, if I've had an experience with an entrepreneur, a small business owner, that resonates with me, especially when I know what the story is behind their product or service. So I seek out opportunities to learn about the why. So tonight, I am going to introduce you to Niasha Fray, and she is the CEO of Niasha Fray Consulting. We're going to talk about a few things, mainly health equity, but also podcasting, because not only do I bring you products and resources and information, but I'm also on the learning path myself. I'm here to learn alongside other friendpreneurs. Being new to the podcasting world, I want to find out from someone who's done this for a while what the tips and tricks are. What are the things that I need to be on the lookout for, the things I need to learn so that my podcast can evolve into something great like hers. All right, so I'm going to bring onto the stage Niasha Fray. One moment. All right. Welcome, Niasha. Thank you for joining me.
Hello. Thank you for having me.
Awesome. Is it raining where you are? Because it has been pouring cats and dogs today where I am.
Yes, yes. The heavens have opened up and we are getting all the rain.
I love it though, because, pouring out blessings, rain, I'll take that. It's a sign. It's a sign. I'll take it.
Yes, indeed.
All right. So I would like you to start just by introducing yourself. But as you do that, tell us what your why is, because I want to start with the last page of the book, so to speak, and backtrack to talk about the story that led up to that. Okay. So when it comes to why Niasha Fray is so interested in health equity and why podcasting is such an important tool in getting the message out concerning what you are passionate about, I want to hear why. Then we'll go
Yeah.
from there.
Well, first of all, I want to say thank you, Tiffany, for having me on your show, to inviting me to join you in this discussion. It is a wonderful honor for me as a new growing entrepreneur, small business owner. And I also have to say, you talk about your why, that I don't know if anybody was watching yesterday, but there was a cricket celebration bowl for the HBCU National Championship, and my beloved alma mater,
Okay.
Florida A&M, brought
Mm-hmm.
home not just the SWAC National Championship, but the HBCU bragging rights for 2023. So
Okay.
I had to kind of put that out there because I'm still basking in the glow of
Celebrate.
that wonderful football game,
Yes.
basketball's but football game.
Yes.
I wanted
Yes.
to
Yes.
make sure that our lovely listeners were aware of this wonderful accomplishment.
Absolutely. Congratulations. I am excited about that. Always supportive of the alumni. It's wonderful.
Yes, and our lovely, lovely HBCUs. And
Yes.
that does get into my why.
Okay.
Um, I grew up with parents that made sure that I was very clear about who I was as an African American woman living in the South,
Mm-hmm.
and what that meant in terms of our history, in terms of our culture, and in terms of our activism.
Mm-hmm.
And one of the things that really struck me was not only was I so proud of being an African American and recognizing everything that our ancestors have overcome in
Mm-hmm.
order for us to be here today, but I was also very much concerned about the toll that racism and all other types of oppression have had on us and our mental health.
Mm-hmm.
So I sought out a college and university, Florida A&M University psychology program, with the guidance of my community members who are mental health care practitioners and also had similar values as me, and found that that was the home of Black psychology.
Yeah.
And so we learned a lot about our history before the transatlantic slave trade and our greatness as a people, and how that translates into our mental health and well-being, and how we can use that knowledge to
Mm-hmm.
help encourage other people
Yes.
who are also share our legacy. So that helped me to be concerned about health equity
Mm-hmm.
as it relates to making sure that the things that I see in my community and the things that I experience around me and that I know of, that I'm able to bring those things to the forefront and infuse that into creating what I call community informed solutions to
Mm-hmm.
health equity problems.
Mm-hmm.
So that is just to get us started, and I'm sure we're going to dive deeper into that.
Yes, and that speaks directly to what I understand is your mantra. I am what I do, and I do what I am. So, hearing you talk about your upbringing and how your parents poured into you, who you are, they wanted to make sure you knew who you are. And then you, in turn, sought out a place where you could continue that education, pouring into yourself. And now you are pouring into the community with the research that you do, with the messaging that you're putting out. And yes, I definitely want to talk about that. So I want to talk about, first of all, any pivotal moment that catapulted you into what you actually do, because there
Mhm,
are things inside of us, our values, right, which
mhm,
are shaped by our experiences that lead us to action. At some
mhm.
point, something in your head said, I believe this so strongly. I'm going to do this. Can you think of that moment? Was there a
Yeah.
moment specifically?
I think the most powerful moment for me was seeing my father struggle with his health and finding out that even though he lived in a community where there was state of the art, leading world renowned hospitals and healthcare practitioners, that he, as an African American man, was treated less than. His health and my mother's advocacy was not enough for people in the healthcare ecosystem to care about his dignity, and that what we had to do as family members was really dig into our resources and fill in the gaps to make sure that he had what he needed in order to live a dignified life as a person who was ill and was seeking out healthcare treatment and was seeking health equity. And that included everything from, how the doctors interacted with him, how they talked with my mother,
Mhm.
and how they created treatment plans, or how they created plans for him to be discharged and to be taken home after being hospitalized. And all of those things that I saw and participated in and heard about really um, drove me harder into this field of health equity.
Mhm. And I can understand, having gone through that with my parents. My sister was the strong one, I have to say, and she fought tirelessly on my mother's behalf as she was transitioning and spent quite a bit of time in the hospital. That advocacy is so important when that loved one is unable to ask for what they need, speak for themselves, even be in a place where they can focus on that because they need to focus on their health, being well. So having that voice for them is so important. That's family, right? That's what's closest to you.
Mm-hmm.
But you've gone beyond family. This voice that I've heard in the past couple of days listening to podcasts is not just an internal voice. It is a voice that cares about what's going on outside of yourself.
Mm-hmm.
And your why makes sense. And now the extent to which you have reached out, it goes beyond, it just goes far into the realm of various diseases and various issues and various communities. There's so many, and we'll talk about that when we get to the how you do this podcast thing, but the reach is broad. The guests that you have, range from doctors to authors. The voices that come into your space are knowledgeable experts, people who've experienced things that you want to talk about. So specifically, there's a podcast that I listened to, and I took a note because I wanted to be sure to ask this particular question. And bear with me while I pull that up. But meanwhile, do you want to give us some information about the latest podcast? No. Start with the first one. The first podcast. So after you've decided, I am going to do this, what brought podcasting into that decision?
One, I had gotten hooked on podcasts. Like I was a consumer, right? And so I loved listening to all of these, dynamic voices, people from so many different backgrounds. I usually gravitate to people that look like me, that have similar values as me, but also just like funny stuff, right? I am a communicator. I'm a talker. I love having deep conversations with people. As I mentioned, I started my career in psychology, clinical psychology. And so having conversations, even in terms of my research background, in terms of qualitative research and being able to facilitate individual conversations that yield really rich data, as well as being able to facilitate groups to have really dynamic conversations that help us to create solutions to shared problems and challenges.
Yes.
I realized that there were some voices and stories that don't usually get talked about, but need and deserve a platform. And so I have been, as you mentioned, blessed to be surrounded with a number, I can't even begin to count, of amazing scholars who also have wonderful, rich networks. And so through that, I've been able to pull together 2 seasons of a podcast. Our first season had 17 episodes. And our first series, because I like to talk in series, I talk long and deep, right? Was in response to the challenges that we saw, right? And we experienced as a community, but we saw in the media about the challenges of maternal mortality and postpartum mortality amongst African-American women, amongst women of African descent, specifically in this country, but not exclusively. And as much as I was enthralled with that conversation, I realized that there was a part of that was missing. I was really concerned about, well, what about people who aren't able to get pregnant, who are challenged in the space of getting pregnant? And fortunately, again, I am what I do, and I do what I am. I care about people. And one of the people that I care about was going through a journey to become pregnant.
Mhm.
And she and I had talked a lot about this journey
Mhm.
and how it was so unexpected, how
Mhm.
she especially, but we were unprepared,
Mhm.
even as a friend group, for what that meant, what it would take, even the reality of, the question of, is this really is it possible? How is it possible that we are not able to get pregnant?
Mhm.
And so I realized that that was a big issue and concern that is very much under the radar.
Mhm.
It is not getting very much attention. And so I brought together and invited a number of people to come and have a conversation. And I was fortunate to get two wonderful women
Mhm.
who have both been through this experience, were going through the experience, were supporting other women in their journey. And so that just turned into the beginning
Mhm.
of a podcast that is
Yes.
now in its second season.
I don't think you mentioned the title of your podcast.
The podcast, yes, thank you for saying that. The name of my podcast is Questions You Didn't Ask.
I love it.
And yes, and that title is one that I struggled to find. And then when it came to me, I said, that is exactly it. Because there's a lot of questions that we don't ask. We don't
Aisha,
even know to ask.
let me tell
And
you,
yes,
I would say I am the most questioning person there could be on this earth. And sometimes I hold them back because I know everybody doesn't want that. But I do
mhm,
not like small talk. I feel like small talk is such a waste of time and energy. And the questions that come out of me that draw real talk sometimes may not be comfortable, and
mm,
I wasn't always one to ask questions that would draw hard conversations, but the older I get, the more seasoned I become,
there
the
you go.
less patience and tolerance I have for small talk. So when you
Mm,
talk about questions you didn't ask, that draws me in, just the title alone, because I know we're going to get some meat and we're not going to be
yes,
wasting our time with small talk. So I appreciate that. That was good, very creative.
wonderful.
Now, I found the question that I was going to ask you about a particular podcast. Okay. And it's about community, the power of community. Community
Mhm.
stands out for me, with friendpreneurship being all about community and drawing together entrepreneurs so we can learn from each other. So, this particular one was series one of Questions You Didn't Ask: Advancing Accurate Representation in Clinical Research, episode
Mhm.
4. And it resonates with me because, like I said, the power of community was called out. A specific demographic was asked why they did not participate as much in clinical trials as people thought they ought to. And their answer was because they didn't see themselves represented in that space.
Mhm.
Now that some things are changing, apparently, from the podcast in the federal level to allow them to see themselves, there's residual impact within that community. And now they're responding within their community to encourage one another to do more, even outside of clinical research, to participate in census, to
Mhm.
make who they are more known broadly. And there's some traction being made there as far as community building is concerned. So I'd like to talk about what your thoughts are on how representation and community matter in messaging to mobilize people to participate in programs that are created to help them.
Yes, yes,
That
yes.
episode or anything related.
Wonderful, wonderful. Yes. This particular series is, all of them are special to me. All
Mhm.
of them are special to me. This one was in partnership with the FDA Foundation,
Mhm.
the Food and Drug Administration Foundation. And what happened was that I learned about, through some of my colleagues, about the Depict Act, DEPICT,
Mhm.
Depict Act. And that is an act that was put in place by Congress and FDA to enforce, that required, no longer recommended, but required for clinical trials and research to be more representative of the population, basically improve and increase the access and participation of more diverse populations in clinical trials. And fortunately, the FDA Foundation and we got together on this shared goal. And so that is a part of community, right? Finding people that have similar and shared goals as you. And so in that conversation, as we were developing what this podcast series was going to be about, we also tapped into additional experts that we thought would be able to bring this topic to light, the work that's happening, not just at the federal level, but in our grassroots communities, right? And so one of the most important things is that, the FDA Foundation is not just concerned about clinical representation in research, right? Diverse representation in research. They are also concerned about how do we and why do we report about our race and ethnicity in what's called real world settings. So that means when you go to the doctor, and before you see your doctor, you speak to the receptionist, and she gives you a nice little clipboard, and some of the information that's asked there is about your race and ethnicity. There are some people that do not feel comfortable disclosing that information for a number of different reasons. They're concerned about discrimination. They're concerned about being tagged. Some people are just like, why is this still important? Why do we need to be concerned with what my race and ethnicity is? I am sick, I am ill, and I need to get better, and I'm a human being. That's all you need to know. I wish our world was that straightforward.
It's not.
It is not. And so one of their efforts that they have is to help to improve the way that we ask the question, help to improve the types of responses that are available for us to click off, and also to really engage the community in helping to come up with those solutions. That's something that I'm very, very passionate about. I call it community-informed solutions, right? I'm very well educated. And with that, I have a lot of knowledge. I'm also very spiritually in tune. So I have a good sense of my spirit. But when I'm working with community, it's very important for me to ask them. Even though I may have some ideas and suggestions, it's really important to ask people, what do you want? What do you need? And so that's what I mean by community informed, and pulling people into that process of saying, we have all of these health conditions that we still don't fully understand. And in order for us to understand them, we need to see and interact with people of diverse racial, ethnic backgrounds, and a variety of other intersectional identities in order to really understand how does the human experience, right? Because a lot of these labels that we have are not biological. They speak to our experience, right? How do these different human experiences influence the way that our bodies deal with different health issues, health challenges? And if we only have one type of people to study and observe or give us insight, then we only have data that reflects that particular group's experience. So you've got to have leadership, right, that sees this as valuable. And hopefully they also phonetically represent, these different diverse populations. In other words, they look like the communities that you're trying to reach, right? They have similar backgrounds, or they have similar identities, so that they hold similar values and understand why we need to have these people represented.
Yes.
We also want to make sure that we're touching base with organizations where different diverse populations are engaged, and where we can talk to them on their level, and find out from them what is scary about research,
Mm-hmm.
what is exciting about research,
Mm-hmm.
and how can they safely participate, right? And
Mm-hmm.
so, with that, when you have a group of people and you can get to those answers or start to discover them together, then you can start to create, a research study that
Mm-hmm.
helps people feel like this is going to lead to information that will make an impact in
Mm-hmm.
my life or the life of others that are similar to me. Whether
Mm-hmm.
that, my participation in this research study led to, and I'm just using this as an example for illustration, led to an incremental increase in information that helped them to eventually come up with a cure for a disease in the future,
Mm-hmm.
right? So we build off of data, we build off of research and information in order to help us incrementally come up with safe
Mm-hmm.
solutions that can support the health and well-being of diverse patient populations or
Mm-hmm.
diverse populations in general.
Mm-hmm. I like that you mentioned safety twice. When you go back to the root of it and asking the people what they want, safety is number one, whether that's psychological or physical. People want to know that if I am giving you a piece of me or being vulnerable and sharing, I need to be safe doing that, right? The other part is the education. So once
Mhm.
people know, after you've learned from them what they want and what they need, then responding with the education that they need so that they have the information they need to make the best decisions for themselves, then they are more willing and apt to participate. And as you said, there's a residual, or there's a trickle down effect, exponential. Once someone gets it, their influence is so powerful within their own community, and it just balloons from there. I think that is so important when people have that information. When people don't have the information, there's a level of ignorance because they don't know that what you're offering is helpful, which
Mhm.
is, I think, so important when it comes to the platforms we use to educate. Now,
Mhm.
podcasting seems to be a really big deal now because outside of television and radio, people are online and
Mhm.
podcasts are online. This is where people get their information now. It just is. So if there's earbuds in the ear, or the information is playing in the car, wherever we are, we have access to podcasts. So the way you have set up your series, I really am impressed because as I was going, I use Spotify. So I was looking on Spotify at your series, and I saw how you divided up your topics in series, and you kept going. That could be a part 1, 2, 3, or 4, but there could be another series. The way you've done that allows you to keep building upon the topics that are under discussion. I like
Mhm.
that. And then as I'm listening to, say, part 3 to part 4, there's a natural transition happening. It's like an ongoing discussion about a single topic rather. And I like that because it flows so well. I can go in there and pick up where I left off and know that we're still talking about the same thing, but it's going to be an evolution of that discusussion. So I was engaged and I was intrigued and I wanted to hear more. So
Good.
tell me how, since I'm new to the game, I'm just here because I love communicating and I love talking with people about their why. But there is an art to this, there's a method to the madness. And when you're in the game, you're starting out, just don't know enough. So tell me how would you say um, one should set up their podcasting to be most effective based
Right.
on the topics they're sharing and the audience they're trying to reach? And what kind of tools and resources and knowledge did you tap into as you were getting started so that you could be where you are now?
So I have to share and give a shout out. We're friendpreneurs, so we're always encouraging each other to give shout outs to other entrepreneurs that help us
Absolutely.
along the way and that we're inspired by. And so my production team,
Yes.
Straight to Tape Productions,
Get out of here.
get out of here. Our
And I know
homie.
that. Yes. Classmates.
Yes, straight from Enlow.
Mm-hmm.
Right.
Mm-hmm.
So Straight to Tape, tap into your networks. Talk to
Yes.
people about what it is that you have on your mind. Listen to them to find out what it is that they've got going on, and
Yes.
check out what they're doing. If you like what they're doing, ask them to partner. They might be looking for somebody just like you
Mm-hmm.
to take their business to the next level.
It's true.
So Straight to Tape Productions, they have a number of different podcasts,
Yes.
and one that is of their name.
Yes.
And mine brings in a slightly different angle, and they enjoy that.
Mm-hmm.
And so they help me behind the scenes with a lot of the technical aspects of running a podcast, the
Mm-hmm.
pros and cons to different things. They help me come up with decisions around, you know, what platforms to use. They help me come up with decisions or answers and decisions around who to invite and what to talk about and when. So
Mm-hmm.
we have meetings on a regular basis about what it is that we're going to do. And we plot and plan out, and we go and find people
Yes.
and work together to make it happen and bring it together into a nice package.
Yes.
Um, and as it relates to coming up with topics, oftentimes I'm inspired. I'm inspired by what I see in social media, in the news. I'm
Mm-hmm.
inspired by what my friends and colleagues who are amazing, what they're doing in their personal and professional life.
Mm-hmm.
And then I see connections.
Mm-hmm.
There are oftentimes a lot of connections between these different things that we're seeing and experiencing. And also because of my training,
Mm-hmm.
I know that I can usually help to draw different connections together that maybe other people wouldn't see right away. But I try to present them in a way that it becomes a little bit more obvious.
Mm-hmm.
Um, the way that the series goes is that we have really long conversations,
Mm-hmm.
right? And so we have really long conversations with our guests. We don't ask them to record multiple times. So if you have a topic that you're interested in diving into that's related to health equity or what we call the social drivers of health,
Mm-hmm.
hit me up, let me know. And we'll have another long conversation.
Mm-hmm.
And my talented production team, Straight to Tape Productions, they do a masterful job
Mm-hmm.
of cutting that conversation up in a way that you would never know that's what's happening.
See, that's how you tap into your friendpreneurs and let them do what they do well, so you can do what you do well. Stay in your lane, have the conversations, let them do the technical stuff. Because I don't even want to think, as a solopreneur, we wear all the hats, and we can only do that for so long. This
Yes.
is why I have this community building underway, because we need each other so much if we are
Yes.
going to be great in our space. Let them
Yes.
be great in their space, collaborate, work together, and make it happen. That's how it's supposed to be. I love this story. Tell me more. Need some more.
So a lot of what I learned was kind of I just jumped in. I just jumped in and did it.
Mm-hmm.
I had there was a time where one of my close friends, family friends, she came to me about a voiceover for a project that she was doing. And she was like asking me to read a script to like make sure that it was good.
Yes.
And she said, you have a good voice. Okay. Note to self.
Right.
She said, you have a really good voice, for doing this type of work. And I was like, I love talking. I love facilitating conversations. That's something that you can also hire me for. If you have conferences, if you are having strategic planning, if you are doing, panel discussions and you need a host or you need someone, I love doing that stuff.
Yes.
It's important to do what you love, what you're naturally talented at. I was a student that was getting in trouble for talking too much in class.
And look at you now, teacher.
And granted, there's a time and place for everything, and I had to learn that.
Right.
But it's really important to listen to what people are saying to you, especially if it's one of them friends that don't mess around with giving unwarranted compliments, and they're gonna shoot it straight. Listen to that. Take note of that.
Right.
As I mentioned before, I'm privileged. With my education, I've worked really hard. I knew how to do interviews, how to put questions together, right? And I also knew how to get people interested in the platform. A lot of people that I interview on my podcast, I had never met before. But I spoke to them honestly, and I came right at them with what it was that I'm doing, what I thought that they could contribute to the conversation, and the value that I thought they could bring to the platform, to the discussion, and how they could also use it to bolster and lift up their own message, that dynamic. So just like what we're doing today, I'm publicizing this Facebook Live and our conversation in your podcast on my platform, just like you're publicizing it on your platform.
Yes.
So we're able to join forces in terms of who our listeners are, who our followers are, and that multiplies our reach. And the point is that the things that we're talking about are things that we really want more people to know about. We're just not making stuff up, right?
You got time for that.
We're talking about substantive things that can help us to not just feel better about ourselves, but to do better, to think differently, and to be better informed about what the lived experiences of different people are. And so that's just some of where I'm coming from in regard to how I put this together, and how I stay, and also I have to say that the response that I got from family, friends, colleagues, different listeners was so positive. I was just talking to one of my good colleagues yesterday, good friends, one of my family rattlers, who's a child psychologist and a professor. And she was saying, this is really good content. And that fuels me. That encourages me, because I admire her. I think she's awesome. And the work that I do, I know she's making real impact in the lives of people. So those things go a long way.
Yeah. Yeah. So your team, your production team, they are very crucial in the success of your podcast. What about sustainability when it comes to relationship building? Like I said, we need one another. So the podcast production is just one piece of the pie. There's so much more to running a business. And as an entrepreneur, just have to figure out where you can do your best work, and then trust other people to help you with the things that are not your forte, right? But are there. So when it comes to building relationships so that you can sustain and evolve your business, how do you approach that? Whether it's a stranger, someone you're meeting for the first time, and you think, oh, they have something that I need. Let me initiate a relationship with them. Or somebody that you do know, approaching them to see if you can collaborate in a way that both of you can help one another. How do you navigate the relationship space when it comes to entrepreneurship?
Yeah, building relationships, that's something that I actually make time for every week. Whether it is reaching out to new people, or re-engaging folks that I have been in touch with over the years. Building relationships is key to my success, because those relationships and planting seeds is something that we talk about a lot as entrepreneurs, where, you talk with someone today, it's probably not going to lead to any money or contracts right away.
Right.
But what it does do is it keeps you top of mind amongst people who do similar things as you, but may need to extend their capacity. Because like you said, just like I need a team, sometimes other people need team members.
Yes.
I'm glad to be a team member, right? So a lot of times I let people know, hey, these are some of the services that I offer. I know you know how to do these things masterfully, but if your hands are full and you want to pursue an opportunity and you need someone to take some of the load off and we can share and both of us can, prosper from that, I'm here for that. There are also folks that will say, hey, we had a wonderful conversation, and then I went into a meeting and learned about this grant that sounds great for you. I don't have time to apply for it, or I don't think it'll fit me, but it seems great for you. Yes. I was just awarded a grant because of that type of conversation. And so I just want to share that there's a lot of things that Niasha Fray Consulting is doing that's not on the podcast. A lot of partnerships that we're building to build out the podcast and do more with the podcast. But building relationships is really important. I recognize I did not go to school for business.
Right. Didn't either. English.
I went to school for psychology. I went to school for clinical psychology. I went to school for public health and health behavior. I did not go to school for communications. I even have held on to and continued to nurture relationships with mentees, students who I worked with, because I worked a long time in higher education at both UNC Chapel Hill and at Duke University. And in those capacities, I was often called on to be a preceptor for different graduate students. And I saw talent in them. And I helped to pour in talent into them. So when I came to start to do my own business, some of them agreed to work with me again. And the fact that I was able to offer them some type of money, oftentimes not a lot yet, but my goal is to get to a point where I too can start to pay a living wage to people that are on my team. That is one of my goals. So if anyone is looking out there to fund someone like me, those are some of my financial goals, is to get to a point where I can keep certain talented people on my team and on retainer, if you will.
Yeah.
So, there's no limit to what relationship building can lead to. One of the areas that I'm passionate about is working across sectors to pull together resources in such a way that we can really start to make a systematic impact on advancing health equity. I was fortunate to be a program director at Duke University. And one of those jobs, one of the things as a program director, was that I brought together leadership, C-suite level leadership from different sectors. So what are sectors, Niasha? Sectors are the different parts of our culture, our society, that help to make any community go, right? So you have an education sector, you have a business sector, you have a nonprofit sector, you have a faith community sector, right? So we have all these different sectors. And if you look at each one of them, they all have specific skills that they bring to any community that makes them great. But we all live and work in the same community. So none of us are, separated from issues of population health, community health, public health, health equity. We're all touched by that.
Yes.
And so when you can see that there is a unified problem and help to build relationships in order to create what we call collective impact.
Yes. I love the way that.
Right?
Yes.
then we can start to see the needle move.
Mm-hmm.
And so even that type of relationship building is key to coming up with solutions, sustainable solutions for big, big problems.
Mm-hmm.
We are amazing. You know, we're in an amazing country. We're in an amazing time. Sometimes we don't like it,
Mm-hmm.
but we have a lot of resources that if we were to work together and find out, hey, I can do this part. I've got a communications platform that I can use. Hey, I can do this part. I can do the fundraising or tracking of the funds and resources. Hey, I can do this part. I'm great with being in the community and talking directly to people that are impacted and
Yes.
connecting them to care and resources. Hey, let's work together so that
Yes.
we're not all just doing something on our own in what we call silos. We're all
And
working in a
wasting
silo
time.
and
Yes.
wasting time and
And
resources.
resources. Yes. Effort, money, steps, words, energy. So much is wasted when we try to do everything by ourselves. And what you were talking about, I hear friendpreneurship all up in there, because once we tap into, say, just one person, I'm talking to you. I know
Right.
what you can do. I know that it's not something exactly what I'm doing, but if I can work with you to take my next step, then that time has been saved. The energy has been saved. I have not wasted money. It is so important, but the conversations have to be had. You know, we can get so busy doing all the things, and we are in our silos and we are doing all the things alone. But if we stop for a moment, if we pause and say, this person can use their talent to help me, I can use my talent to help them. You collaborate, you work together, and go from there. The community that is built with that trust is so important, and exponential growth can happen for everybody, not just one person slowly. But if we work together, we can get there, not necessarily faster, but in better condition. And I love that part too, because we can wear ourselves out. We can kill
Oh,
ourselves trying to be the best entrepreneur in the world. But without each other, we can't do it. We can't.
no,
I
you
appreciate
can't.
all of what you're saying here.
And just like that, if any of your viewers were watching me like look down, that's
Mhm.
because I had to call on my village to help me because my daughter's trying to come in the room and interrupt our interview.
Speaking of which, we haven't talked about your daughter. And I
Oh,
want to end on
wow.
that note, because we started with family. We talked about your mom and your dad instilling these values in you in the beginning. Let's talk about how full circle it has come, the way you pour into advocating for your own daughter. You want to talk about
Yes.
that a little, and then we'll wrap it up.
Right. So I'll say this briefly. I have one daughter, and she is my favorite person in the whole wide world.
Yes.
And she's 10 years old. And I found out when I was pregnant with her that she had Down syndrome. I also
Uh-huh.
found out that she had a congenital heart defect.
Mhm.
And so I made sure to take time off when she was born to
Mhm.
pour into her and her health and well being. And I'm going to tell you, it has paid off. It has paid off because she has Down syndrome.
Yes.
We participate in all types of fun family activities. We raise money for our Down syndrome communities, both Gigi's Playhouse, the North Carolina Down Syndrome Alliance, and a variety of other organizations. She and I will have to call out Dr. Joy Weber, who is a very good friend of our family. She feels like family. She set the tone for disability justice and disability rights in my life as I was growing up. And so, as Molly, being my daughter, came into this world, I took on putting my time and my talent
Mhm.
into two organizations specifically. First in Families of North Carolina as a board member and their inaugural Equity Task Force chair.
Mhm.
I also was invited by the North Carolina Down Syndrome Alliance to serve as the inaugural Black Families and Community Group liaison. And
Mhm.
so, what we do is we want to bring more visibility and community to our children of African descent, whether they're mixed or whether they both parents were Black,
Mhm.
even if their parents are white and they were adopted. we create community around those children so that there's culturally relevant information and opportunities for us to live and grow and be abundant as a beautiful and thriving community of families that love people with Down syndrome.
Mm-hmm. Representation matters.
Yes, it does.
Okay, so I don't want to keep you here all night. Talk. I love to talk.
You know we can talk.
But I will just leave you with the last moment after I make a couple of announcements, because I want people to remember what you say last. Okay, so think about what you want to share with our audience tonight concerning health equity, concerning podcasting, concerning your thoughts right now about current events, anything that is poignant. Okay, so I'm going to make my quick announcements. Friendpreneurship is making some plans for 2024. And the more I have conversations with people like you, Niasha, and learn about your journeys, learn about why you do what you do, the more inspired I am to help even more people tap into each other as resources. So I'm planning a membership. January, I'll be launching a membership option under Friendpreneurship in this community so we can continue to get together in different capacities. We're going to, of course, continue our quarterly conferences. We're going to make sure the podcast goes on, but I want to sit down with people maybe bi-monthly to have casual conversations, putting people in rooms together. This is always the goal, putting people in rooms together who are at various stages of their entrepreneurial journey, the subject matter experts, the people who need exposure, and those who are thinking about becoming entrepreneurs. Put them all in the room together because somebody knows something that the other doesn't. And pouring in and pulling out, that's all about that community, the community building and making sure that we're learning from each other, because we don't want to be statistics. You know, the statistics are 50% of small businesses fail within the first 5 years. And it's because of cash flow issues. 50%. Cash flow issues are the main reason. But if you go a little deeper, it's because people don't know enough. Like you said, we didn't go to business school. So we may have a vision, we may have talent, and we may have passion, right? We could jump in there head first. Trial and error is our business plan. Sometimes, nope. Somebody can help. The ones that do know, if they are friendpreneurs, friendly entrepreneurs who are not afraid to bring others along for success, if they are friendpreneurs, they're willing to be a part of this community. So I'm going to offer that option and see what happens. I am confident because I've gotten feedback from some areas that I trust, and I believe that 2024 is going to be a really good year to continue building this community. So stay tuned, everyone, for that announcement late December, and get involved. There are many ways to get involved. You can be on the podcast. You can come sit with us twice a month to talk. You can follow Friendpreneurship and be a part of the conferences, sharing your subject matter expertise. You can come and learn. You can share. It's all about sharing. So I just wanted to throw that in there. All right, Niasha, have you had a moment to think about what you want to leave the audience with today?
Yes. So one of the things that I want to, along those lines, draw people's attention to is the lawsuit against the Fearless Fund that is happening right now. I am not personally attached to or connected to or professionally attached to or connected to the Fearless Fund, but I am deeply concerned about what is happening in regard to the Fearless Fund and this lawsuit. And that is that this fund is intended to support women of color, specifically Black women, who are leading businesses that are looking for pre-seed, seed level, or Series A financing. And it's to bridge the gap in venture capital funding for women of color founders building scalable growth and aggressive companies. So this fund is under attack politically for what some consider it being discriminatory. And so do what you can to learn about that lawsuit. Do what you can to provide whatever resources and support that you can, because if that lawsuit goes through and the person who is suing Fearless Fund wins, that could cut out a lot of race and gender-based funding opportunities for business owners and a variety of other things.
Mm-hmm.
In addition to that, I must say that it is very important for all of our entrepreneurs, but specifically for me, if you would subscribe to Questions You Didn't Ask. It's on all major podcast platforms. We are on Apple, Spotify, Google Podcasts, wherever you listen to podcasts. Check out Questions You Didn't Ask. Subscribe, like, share, comment. Niasha Fray Consulting and the Questions You Didn't Ask podcast are on Facebook, LinkedIn, and Instagram. I am available to talk with people about opportunities to work together on contracts and grants. My focus areas are health equity research and action, health communication, patient advocacy, community outreach and engagement, diversity and inclusion in clinical trials, community-informed metrics and evaluation, and more. So I am fortunate to have over 20 years and counting of experience in these fields. And I am ready to work with people to help create some solutions that will make impact in our community. So check me out at Niasha Fray, that's Niasha, Fray, Fray.com. And I will be glad to talk with you.
Awesome. Thank you so much for your time this evening. I am thrilled to learn as much as I can from as many people as I can so I can have the information that I need to make the best decisions for myself so I can be a better resource to my community of entrepreneurs. So I appreciate all of your time. Thank you.
Thank you so much for this opportunity.
Okay, Niasha, enjoy the rest of your evening.
All right, you all do the same. Have a good night.
Bye-bye.